Hello, everyone, and welcome to today's session titled Fostering a Patient-Oriented Research Ecosystem, Lessons from BC Support Unit Fraser Centre. This is hosted by Community-Based Research Canada. My name is Julia Coburn. I'm the CBR Canada Program Coordinator, and I'll be the moderator for today's session. So Community-Based Research Canada, its mission is to advance community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing CBR among individuals, communities, and institutions. For 10 years, CBR Canada has brought together key players of community campus partnerships. Some CBR Canada founding members continue to be on the board today. Our network builds capacity for academia and broader communities to collaborate and use research as a tool to mobilize community participation and action. We'd love to hear from you throughout this webinar and encourage you to share your comments and questions in the chat box in the lower right-hand corner of the webinar. And I will share your questions with the presenters during the Q&A period, which will take place with the last 15 minutes of the webinar. I'm pleased to introduce you to today's presenters, Alia Janawala and Brittany LaPietra. Alia is the Knowledge Translation Specialist for the BC Support Unit Fraser Centre. Alia works with researchers and public partners across the Fraser-Salish region to promote the use of integrated knowledge translation strategies and patient-oriented research projects, and to implement evidence-informed initiatives to improve patient outcomes and health. Prior to this role, Alia worked with the Knowledge Translation Program in Toronto, supporting population health implementation science research projects. She gets experience with community-based participatory research projects and knowledge translation activities, including community forums, decision-making tools, educational projects, and products, and academic publications. Brittany LaPietra is the Simon Fraser University Research Navigator for the BC Support Unit Fraser Centre. Brittany supports faculty, students, and staff at SFU in conducting patient-oriented research. She advises on patient-oriented methodology, ethical considerations, grant applications, and facilitates collaborations with non-academic stakeholders within the government and health authorities. Prior to this role, Brittany worked as a lawyer and subsequently applied that experience to a role in the Office of Research Ethics at SFU. Ask Brittany about team facilitation and leadership, developing patient-oriented grant and ethics applications, and skills training for research and communication. So I'm going to let Alia and Brittany take it from here.
Checking to make sure everyone can hear me and see me, because I see a message in the chat box that, oh, it looks like our sound is not working. Oh, some people can hear and see me, some people can't. Okay. Okay, I'm gonna get started because it looks like most people are saying that they can see and hear me. So thank you so much, Julia. I know Alia and I are both very excited that you asked us to come and present today. And I do just want to get started by saying that Alia and I are both currently situated in Vancouver. We would like to acknowledge that we are gathered on the traditional, ancestral, and unceded territories of the Semiahmoo, Katzie, Coquitlam, Kwantlen, Kikite, Tsawwassen First Nations. And we recognize that many of you are joining us from across the country, and we urge you to just take a moment to acknowledge the traditional land that you are on today. We also recognize that we have a lot going on in our personal and professional lives right now, and we hope that we can take this next hour to really connect virtually and to discuss the ways that we can move forward and conduct research at this time, because it is an uncertain time, and hopefully we can learn from each other. I also just want to have a little bit of transparency that Alia and I are both not coming to this webinar today as CBR experts. We work specifically in the patient-oriented field, but we are hoping to shed light on what we can learn from each other today. So just want to make sure I can flip through here. Okay, so we want to get started, and Julia, if you can give us a hand here before we really jump into everything. We want to get started with a couple of poll questions. So the first question that we have is, do you work in health-related research? Yes or no? How familiar are you? And sorry, I'm not sure if you can see. Oops. There you go. So if you can click on the response there, and then how familiar are you with the term patient-oriented research or Canada's strategy for patient-oriented research? And then finally, if you're located in Canada, what province or territory are you located in, just so we can get an idea of where everybody is at today. Okay, thanks so much, everybody, for participating in that poll. So it looks like we have 76% of people have said that, yes, they do work in health-related research. 4 folks that are on the call here do not. Also, how familiar are you with Canada's strategy for patient-oriented research? Bit of a split here. We have some people that are very familiar and some people that are somewhat familiar and a couple of people that are not at all. So that's great. We're going to give a bit of a basic overview today and then delve a little deeper into some other more detailed components of it. And then we've got a bunch of people here from BC, where we're located, some people in Ontario. We have one person from Quebec. So that's great. We're spread out across the country, and good to get to know you guys. And Julia, if you'd mind switching us back over when you have a second. Thank you. Okay. So let's get right into it. So we are here today to talk about patient-oriented research, which is part of Canada's strategy for patient-oriented research. And for those of you who are not familiar, CIHR, or the Canadian Institutes for Health Research, is the major funding body for health research in Canada. And they took a step back and started to think about, is the work that we're funding and is the research that we're funding and supporting in this country actually ending up benefiting patients in the way that we hope it is? And there's some evidence that suggests that up to 50% of patients do not get treatments of proven effectiveness, and up to 25% actually get care that is not needed, or it could even potentially be harmful. Those numbers are not good. So CIHR looked to what they could do to improve this situation. And they developed this strategy called the Strategy for Patient-Oriented Research, which is Canada's strategy to ensure that the right patient receives the right intervention at the right time. And the way that we do this is by increasing the amount of research being conducted with and by research knowledge users, including patients, caregivers, healthcare providers, healthcare practitioners, including clinicians, physicians, nurses, and so on, as well as healthcare decision makers. So those could be people that work in health policy in the government, healthcare administrators, or people who are making decisions about healthcare at the clinical level every day. And I just want to take a second here to point out that we are not just talking about clinical trials here. SPORE may have emerged as a response to conventional failures in biomedical and clinical health research, but much of the work we support isn't medical research in the classic sense. We've worked with teams looking at preventing falls in elderly populations, wearing biotechnology. We're looking at walkable neighborhoods, developing toolkits for things like anxiety and other mental health issues, quality of life of families and children living with autism, dietary needs of tube-fed patients, and a lot of health research priority setting projects, including one with the South Asian community in BC. And that's just a small sample of some of the projects that we've worked on and supported. So you can see we take a very broad definition of health, and we take a social determinants definition of health in the work that we do. So CIHR, in order to implement this strategy, gave some money to each of the provinces and territories to set up something called support units. And support is an acronym that essentially stands for support. So support for people and patient-oriented research and trials. There are 10 of these across Canada, and BC has one, and it's called the BC Support Unit. You may be familiar with your own support unit in your province, and it might have a bit of a different name. So in BC, we're split into regional centres because we do have various health authorities in BC. We have 5 health authorities and 5 regional centres to go with them. And each regional centre is a partnership between the local health authority and the local university. So today we work with the Fraser Centre, which is a partnership between Simon Fraser University and the Fraser Health Authority. And we are, sorry, I just changed the slide here. And we're going to be talking about this context today because this is where we're located. One benefit of having the regional center set up this way is that it leads to the institutionalization of patient-oriented research. It means that there's dedicated allocation of resources specifically for patient-oriented research. There's institutional and leadership support for it. And most importantly, it fosters really important relationships and networks between academia, healthcare practitioners, decision makers, and patients that use the health authority. And in your province or territory, the structure of your support unit might look a little bit different. I think BC is the only province that has this regional local delivery system. Okay, so the goals of the BC support unit are to build capacity to conduct and implement high quality patient-oriented research in all regions of the province, to increase the quality and impact of patient-oriented research across BC, and to ensure the ongoing support for patient-oriented research in the province as well. So we've been talking a lot about how we support patient-oriented research, but what exactly is it? So based on the definition provided by CIHR, it's research that engages patients as partners, focuses on patient-identified priorities, improves patient outcomes as defined by patients, aims to apply knowledge generated to improve healthcare systems and practices, and the key point is that it's conducted by multidisciplinary teams in partnership with stakeholders in the healthcare system. And those stakeholders I've already alluded to, but are patients, and I'll go into how we define patient in a second, healthcare providers, healthcare decision makers, and academic researchers. Okay, so when we talk about patient-oriented research, we're talking about research that's done with and by patients, not on, for, or about. So this really means that patients are team members on research projects. They're not necessarily in that same traditional role of research participant or research subject. These are people that are actually brought into the fold, are helping to create the research alongside the people that would be traditionally in a researcher role, such as an academic or a clinician researcher. And how do we actually define who can fit in that role? Who is a patient? It's a person that has experienced a healthcare issue or a healthcare system, or the healthcare system in some way, and that includes informal caregivers, family, friends, people in that person's network or community. And so you can really see it's a very broad definition. It can include almost anyone who has an interest in a certain topic that's healthcare related. And we do recognize that patient isn't always the right term to use and that it can be quite off-putting for some people. And that's totally acceptable. We're stuck with that language because that's the language that CIHR has chosen. But we are open to a research team speaking with the people that want to join their project in that role and see what they're comfortable being labeled as. So client is one that we see sometimes, community member, person with lived experience, whole variety of different types of terms that people feel comfortable identifying with. But for the purposes of today's presentation, I'll continue using the word patient because that is the word that we use because of CIHR's terminology. Okay. So why do we take this approach? Why do we engage patients? As you can see this image, I really like this image because it shows that you can have the best of intentions. You can design something that's really pretty and beautiful and looks like it'd be really great to use, but it might not be effective or appropriate or in the right place at the right time for the person who's actually using it. So we want to engage the user, the knowledge user, who could be any of those stakeholder types that I mentioned, primarily the patient though, in how you can actually use what you're trying to create and make sure that you're doing it the right way and in the best way to make sure it can actually be useful and effective. And it is important to consider the patient partner before you're actually implementing a design, but not just implementing it, but actually designing it. So really getting patients involved at the very beginning of the process is super important. So in order to assess the level of engagement that we have on and how involved patients and other stakeholders are on a project, we use this scale from the International Association of Public Participation, or IAP2. And we look at the scale from the low end of engagement being just to inform someone, to provide them with information, kind of like what I'm doing today. I'm just talking to you, giving you the details, but we're not having a dialogue. And then it goes up increasingly in the level of engagement all the way up to empower, where the person being engaged has the power to actually decide. When we support teams to do this kind of work, we usually try to ask them to aim for something in the range of in the collaborate zone, recognizing that this is a team-based approach. We want people to collaborate and really come together and not necessarily give all the power to one person in the room. I also just want to address that there are other organizations around the world that do similar things to what CIHR has done here in Canada. So in Canada, we use the term meaningful and active collaboration when we talk about the definition of engagement. In the US, they have something called PCORI, which is the Patient-Centered Outcomes Research Institute, and their slogan is research done differently. We also have another institution in the UK called Involve UK, and theirs is research by and with, not on, for, or about. So you can see a lot of overlap in the way that we think about engagement, but they are a little bit different. So one of the most common questions that we get from research teams is, okay, we tell them all about patient-oriented research and about the principles behind it. And most people seem to agree that it sounds like a good idea, but then they kind of stop and think, well, how do I actually involve a patient in my research? How do I actually engage with patients and other stakeholders who aren't traditionally researchers in this way? And we kind of, run through this big long list, and I'll read you some of these examples, but the short answer is that you can really engage patients in any area of the research cycle, all the way from setting priorities and formulating a study question and study design, identifying a study population, doing recruitment, and really reaching perhaps even hard to reach folks that you want to get involved in your work, asking somebody who's from the community. I don't have to tell all of you this, that can really help you to engage more people from that community. Even designing interventions and actually helping with data collection and data analysis and interpretation of findings, actual dissemination of results and planning how to do that knowledge translation work and dissemination work, and helping to develop tools, practice guidelines, implementation work, things like that. So we really do like to, emphasize that not all patients are the same. Patients come to research with different backgrounds and different levels of experience in different areas, and they might be really interested in being involved in one area of the research cycle, but not another. So let's say somebody has a background as a statistician, and they really want to get involved in that area of the work. Or they might be a copywriter and be really interested in helping you in helping out with the writing. So it's really a conversation that you have with your patient partners to discover what they want to do and where their strengths lie. Okay, so when we think about why would patients want to get involved in research, and what would motivate a layperson to get involved, what we do here is that anecdotally is that patients want to be heard. And part of that is that they want to make sure that an experience that they had can be improved so that the people that come after them have a better experience than they had. They want to see real improvements to the healthcare system for those that come after them. They also want better health outcomes and experiences for themselves, for their families, and for their communities. And I think this really highlights that answering questions that matter to patients and asking them, what do you want us to research, is only half the battle. And patients really want to see the benefit of the research and the implementation of that work in a real life setting. And that is where knowledge translation comes in. And Ali is going to be talking about that in a second. But I just want to take a pause here and see if anyone has any questions or wants me to clarify anything about the background before we move on. Okay, I'll let Alia get started, and if any questions come up in the chat box, I will keep an eye on it and I can respond in the chat, and then we will have time for questions at the end as well. So thanks, and I'll pass it over to Alia now.
Thank you, Brittany. Hi, everyone. I'm hoping you can hear me. I will get started, but please just put any comments in the chat box if my volume's finicky, if you're unable to hear me at all. So thank you, Brittany, so much for getting us started. I am going to take over talking about the KT side of things, particularly because that's my role as the knowledge translation specialist. So of course, patient-oriented research has to encapsulate knowledge translation. Knowledge translation might be a term that resonates with you, especially if you're familiar with health research. Other terms that you may have heard of might be knowledge mobilization, knowledge brokering, knowledge exchange, research utilization, at a very simple level, just research dissemination. We use the term knowledge translation because it's the term that's preferred in health research. It's the term that CIHR uses. And CIHR defines KT as the dynamic and iterative process that includes the synthesis, dissemination, exchange, and ethically sound application of knowledge to improve the health of Canadians, provide more effective health services, and strengthen the healthcare system. So KT is really about the strategies that you'll use to make something out of your research evidence. This often applies to sharing back your results to your participants, community members, other researchers, but it also applies to strategies to change practices or behaviors so that they're informed by that emerging evidence. Patient-oriented KT in specific means that the people who are most affected by that evidence you're trying to put into action have a voice in shaping that practice change. Involving knowledge users and beneficiaries of your practice change in KT has a number of benefits. First, it can improve the relevancy of that practice change within those groups of people, ideally by fostering buy-in, by tailoring messaging, accessing the right communication channels. It can also increase the uptake of research into practice if everyone in the system is seeing its value and sharing that value through their networks and their communities. And it will improve health service access and effectiveness by appropriately reflecting user needs and values. So patients that we work with are involved in KT activities in a number of different ways. The most kind of common example tends to be assisting with non-academic dissemination activities, like developing plain language summaries, presenting at community forums, things like that. But patient partners and community partners can demonstrate those values and interests to decision makers. And that's a really key role that I think we often forget about. They can also really help with selecting implementation strategies, assisting with evaluation planning, sustainability planning. And we're also seeing more of an interest in the patient partner community to want to assist with academic KT activities as well. So authoring manuscripts, co-presenting at conferences, and activities like that. So over the next few slides, I'm hoping to kind of dive into some common benefits and challenges of patient-oriented research, both that we've experienced through our work at the center and also that's been kind of examined in the literature. As I review these, I would just like you to please reflect and consider on what's resonating to you. Are any of these things that you've seen in your work? Am I missing anything from this list? So just percolate on these sort of similarities and differences between the work that you do and perhaps what we're presenting here, as we'll have an opportunity in just a few slides to open that up for discussion. And like I said, any thoughts that you have, please feel free to put them in the chat box. Brittany's monitoring that. So in terms of some of the common benefits of patient-oriented research, a key benefit is really around fostering inclusive mechanisms and processes for shared leadership and decision-making. And of course, this really comes with an enhanced level of capacity building, right? So capacity building from the research team side of things to learn more about patient-oriented research and patient engagement. Capacity building perhaps from other members of the team to learn a little bit more about research literacy and implementation and actually using evidence. And most importantly, capacity building on everyone's end around enhanced communication and collaboration. We're also seeing this movement away from conventional ideas of what knowledge and evidence are to really understanding lived experience as knowledge that can be mobilized for impact. We're seeing more and more patient-directed research and not just patient-informed research. And the largest benefit that I think is really around this shared sense of purpose and the commonality around a shared set of goals. However, POR does not come without its own set of challenges. I think that a lot of these challenges may resonate with some of you if you're working in the research world. I'm really curious to know what we're missing or how you've been able to mitigate some of these challenges if you're facing them yourself. Much of our work at the center does support mitigating these challenges on research teams. And the ways that we do that are through facilitating meetings, facilitating agendas, perhaps acting as sort of liaisons between patient partners and research teams if needed. And most importantly, providing that training and capacity building to research teams. We do our best to work with research teams to ensure that patient partner involvement is not just a checkbox on paper, but that it's meaningful and authentic. And what does that really look like? We also experience challenges with recruiting hard to reach or underrepresented patient populations. I'm sure that that's something we're all kind of grappling with, especially considering our current context. And I would love to hear what sort of suggestions you have around that as well. Often what we hear at the Fraser Centre from researchers or research teams is that they find it really challenging to establish meaningful long-term relationships that are kind of necessary for patient engagement. And this could be due to pragmatic reasons like academic or organizational turnover. But a lot of researchers often find that there isn't enough protected time and money in grants to support establishing those relationships. We all know that developing trusting relationships takes time. And it takes even more time if you're engaging with people who've been systemically marginalized by the healthcare system or institutions. So the process it takes to build those relationships is just as important as the outcome of doing patient-oriented research. And we try to just support that process as best as we can. One of the ways that we do that is to mitigate the funding issue at least, is by offering dedicated funding awards that are specifically meant to foster patient engagement and meant to sort of compensate team members in being able to use those processes So I pulled out these guiding principles from the literature, and these are guiding principles of patient-oriented research and community-based research. I don't want to read these out loud right now. I'll leave them for you to read and consider at your own time. But as you do, again, please just reflect on some of those overlaps and differences, and perhaps some of the shared commonality that that establishes both of our research disciplines. So this is the time when I'd really like to have a chat discussion if possible. So if you do have any thoughts percolating, please feel free to put them in the chat. And if there's enough of a discussion, maybe we'll take a couple minutes to sort of read those out. As we sort of think about the commonalities and the differences between these two approaches, I think what sticks out to me is that we can really learn from each other's disciplines. When we look at the definition of POR and CBR, there's an emphasis on collaboration, on equity, and on involving people throughout the entire research continuum. From my understanding, and of course I'm not a CBR expert, and I'm sure some of you might have a more nuanced understanding, but from my understanding, CBPR is an older discipline that's been entrenched in the research world for decades. And it can also be broadly applied to a lot more topics. So I see patient-oriented research as sort of sitting under that CBPR umbrella because it really emerged as a response to inefficiencies in the health research world. And it was informed by the successes and key elements of CBPR. So now that we've discussed PR in a little more detail, I'd like to open it up to the audience. What do you think some of the commonalities and the differences are between those approaches? And I'll peruse the comments really quickly. So Francisco added that a challenge that they face in their research is that established researchers may not follow the CBR spirit. They may cut corners and they may make some of those central decisions kind of on their own. This is seen a lot in the HIV research world. I'm not sure if anyone else has faced that, but that's certainly something that we see sometimes as well. And Francisco also adds that CBPR comes from a Southern liberatory and political tradition, where SPOR is an adaptation of some of that CBPR philosophy and practice. And I think that's completely accurate. So I'm gonna leave room for you to continue chatting and offering your thoughts here. I just want to move on a little because we're not the only ones to think about this. We're certainly not the first ones to think about it. I'm not sure how well you can see this figure. I'm hoping you can, but this is a figure that was taken from a paper that examined and proposed ways that patient-centered outcome research, so PCOR, can effectively use CBPR principles to engage patients in general throughout their research study. I think this is a really fabulous figure. If you want to take a closer dive into the paper, I've included the reference there. I do want to make a small caveat, though, that PCOR is the US approach. And while it may be centered around patient needs, it does not necessarily mean that patients are equal partners of the research process like what we advocate for with POR. So I think a lot of the overlap of CBPR principles onto phases of a POR research study definitely apply here. I just want to make the argument that POR goes slightly deeper than PCOR by really valuing shared decision-making throughout the process. Most importantly, I think what this figure really demonstrates are the opportunities to learn from each other's methods and practices. The paper, so this is the same paper, the paper also offered recommendations to mitigate common challenges faced in PCOR through the application of CBPR principles. However, I think these recommendations are applicable to any sort of research study, and they're valuable for us all to reflect on. So I urge you to take a closer look if you'd like. I really like that some of these recommendations emphasized sustainability and incorporating partners in that planning process. I think that's a key element that we don't often see in those research activities. And again, if you've seen this paper before, used it, or found it valuable in your own work, I would love to hear your thoughts, so please include them in the chat function. So at this time, I'd like to show you a few examples of how our center actually walks the talk. So I'll just give you a very brief overview of our Fraser Centre. At this time, we're currently supporting 54 research projects that are currently taking place and being executed. And 2 of these are patient-directed. So that means that these patients had their own research ideas, came to the table with these ideas, pitched them at events that we were holding, found their own multidisciplinary research teams, and have secured their own funding as well. So we're quite excited about that. We also have 90 patient partners engaged in our research and our governance activities. 48 of these patient partners are currently engaged on research teams actively. And I'll speak very briefly to what our kind of governance activities look like. 22 awards were also granted to teams that we support within the last fiscal year. And this is both for our own internal funding competitions that we hold to support patient-oriented research and KT, but additionally external funding competitions where we supported teams in developing those applications. 50% of our requests for services are from clinicians who would like to do patient-oriented research in their healthcare settings. And what we find is that many of these clinicians are new to research. And so this really serves as a prime opportunity to share patient-oriented research methodologies and best practices and sort of get them to drink the Kool-Aid, so to speak. And last but not least, there are various SFU departments that we engage with regularly. I've listed a few of them here. And we've really just done that to show the diverse range of our projects and disciplines, and to emphasize again that health is a really broad concept that can be looked at from different lenses. So our patient partners are uniquely involved in our operations and governance activities. One of these ways is the patients interested in research group. And this is a group that gives patients who want to be more actively engaged in shaping research processes and agenda, a sort of avenue for networking with like-minded individuals. These patients will give input to researchers on their research ideas, assist with patient partner recruitment, and provide training on topics of interest. We also have a core oversight committee that provides strategic, operational, and fiduciary oversight for our center. And this committee is composed of representatives from Simon Fraser University, the Fraser Health Authority, and of course, patient partners. Patient partners also assist us in our activities in a number of different ways. They're usually present in co-developing and co-presenting our training and capacity building opportunities to students, for lectures in academic institutions, or tailored workshops to research teams. Patient partners will provide input on our strategic plans. They serve on planning committees for events that we put on. And they serve on our award review committees as well to contribute to our funding decisions. And certainly last but not least, most recently, we hired 2 patient partners two people who had previously worked with us as patient partners onto our team as staff members. And this has been immensely valuable, obviously for the skills that they bring to the role, but really to have their lived experience as patient partners and recipients of our services inform how we continue to improve our work. And this has been a really novel thing for our team as of this year. So I'm gonna go through 3 project examples just to show you the different ways that we've applied patient-oriented research within our center. The first project is called the South Asian Health Research Collaborative. And this was thought up by South Asian researchers and health providers who understood that South Asian engagement research was severely lacking in our region, despite there being a huge South Asian population in the Fraser region. So there was a real clear gap here and a real opportunity to better ensure that research agendas were being shaped by the priorities of the South Asian population. So our team helped support this project team with planning, with recruiting patient partners and participants, and facilitating this priority setting project. And what was really key here was recruiting this underrepresented populations. So our patient engagement specialist, a member of our team, worked really hard to establish meaningful relationships with community in order to recruit at community events, give interviews on local radio channels for the South Asian population, attend places of worship, and various number of activities. And they were really successful in recruiting, I believe, 3 to 4 patient partners on the team, and 240 participants to complete the priority setting surveys. This was extremely innovative. I know we have one of our patient partners attending the webinar right now. So Swapnil, please, if you have any other thoughts, comments from your experience, please put them in the chat box because I think it'd be really valuable for everyone to see. Okay. Another project is called the Fracture Liaison Service by Sonia Singh at Fraser Health. Dr. Sonia Singh is a clinician who identified an osteoporosis care gap at Fraser Health. But what she realized was that there was already an evidence-based model called the Fracture Liaison Service that was recognized as an effective model to address this gap. It just wasn't being used in our current context. And so Sonia and her team used implementation science methods to assess the context, adapt the program, tailor it, and implement it. There were definitely a lot of challenges faced in implementing a program of this nature, but having a patient partner on the team was critical to its success. Patient partners were involved in identifying the problem, doing priority setting, in adapting the intervention to make it more relevant to their own experiences, to helping with implementation and sustainability planning. Most importantly, the patient partner presented to decision makers. They were engaged in presenting data about the effectiveness in their setting, the potential for cost saving, and most importantly, they were able to speak on the value that this brought them. So speaking the language of the decision makers was obviously really critical here, but having that patient partner at the table helped foster legitimacy and buy-in. And we're very excited to say that this team is doing quite phenomenally. They recently received a grant to scale and spread up FLS across the whole province. So, okay. One last example is around this KT strategy. This is a KT tool created by Dr. Lillian Hung's team out of Simon Fraser University. The point of this KT strategy was to co-create a learning tool on the art and science of person-centered care for people living with dementia, a tool for healthcare providers to use when providing care to this population. So while the tool was aimed at healthcare providers, Lillian worked with patient partners, who are often people living with dementia or their caregivers, to co-design the tool because it was ultimately about shaping care to reflect their needs. This seems to be a particularly underrepresented population in research, but I think what Lillian showed here is that there's immense value in taking the time to accommodate their involvement and that you can still get really meaningful and tangible results at the end of it. So that sort of concludes most of our presentation today. You know, it's hard not to sort of address the elephant in the room, considering we're all living in this new COVID age. We're all in this place of trying to understand how to move forward right now. These are all things that we've been reflecting on as a team, things that I'm sure you've also been thinking of, and things that I'd just like to offer you as fodder for thought. How do we support the communities and the stakeholders that we're working with? what adaptations do we need to make in order to do that? And as we do, who do we risk excluding or leaving behind in this process? I just wanted to leave that with you, and would definitely love to hear your thoughts in the chat box or during the question and answer period. My sort of last offering thought for the day is this really an opportunity for us to learn from each other's disciplines, lessons learned, and best practices instead of reinventing the wheel? How do we move forward in this new age, operate in different ways, try new things, but most importantly, build off of the work that we've all done in our various disciplines? So if you have any questions at all, if you'd like to get in touch with us further, we have, I've put my emails on the screen there, so you can just shoot us an email whenever you'd like. We also have an inquiry form on the bcsupportunit.ca webpage, so you can please, you can check that out whenever you'd like, click on the inquiry form, and it'll send something to us. And I'd also like to make a quick plug for the next CBRC webinar. So please save the date for May 28th. This webinar is called From Patient-Oriented Research to Patient-Led Research, an exploration from the patient perspective by Beverly Pomeroy. I think it's gonna tailor or fall under this one quite nicely. And I think it'll be a really great opportunity to dive into an example a bit deeper. Beverly Pomeroy is a community and patient engagement specialist, speaker, and author, amongst many other skills that she has. She also recently joined our team as a patient engagement specialist, so we've really lucked out on our end being able to have her on our team and have her skills. We really look forward to this webinar that she's going to be hosting, and we're sure it's going to be extremely dynamic and lively, so please save the date and please sign up. Last but not least, I have included some additional resources if you'd like to dig into things a bit further. The BC Support Unit worked with partners across the province to create a set of videos that describe their perspectives on patient-oriented research. So if you'd like to hear directly from patient partners and researchers working in this field, please check out those videos. They're a really great resource. And we also have a number of other kind of resources and readings that I've put on here for you to dive into a little bit further. And of course, if you have any questions, please reach out. We're happy to sort of communicate with you on a more one-to-one basis. And that brings me to the end of our presentation. So thank you all so much for your attention, for your comments. I think we'll get to some of those comments pretty shortly. At this point, I guess I'll hand things back over to Julia to moderate.
Wonderful. Thank you so much, Ali and Brittany. This was an extremely informative webinar that you shared. You took us through quite a journey and so many very helpful and practical pieces of information that you shared. So I know that everybody here appreciated that. I just wanted to mention really quickly that just to let the audience know, a recorded version of this webinar is going to be on the community-based research website. You can see the URL at the bottom, communityresearchcanada.ca/webinars, and it'll be up next week, including the slides. So let's get into the Q&A. So we have a few questions that have already started to come in. One question was from Larry, and please continue to share your questions in the chat box and we'll bring them up as we can. He was asking, how does engaging clinicians and policy compare between POR and CBR?
Brittany, do you want to take a stab at that, or should I try?
Yeah, sorry, I was just trying to unmute myself.
Oh, sure.
Yeah, so thanks, Larry. So I think, like I mentioned at the beginning, is that Alia and I aren't necessarily experts in CBR, but what I can speak to is the strategies that we use in patient-oriented research to engage I think it was clinicians and policymakers or decision makers. Sorry, I'm scrolling up to try and find the question.
Policymakers.
Policymakers. Yeah, I mean, the approach that we take is kind of on a case-by-case basis. If a project needs somebody, or decision makers, he says, okay. Yeah, so if a project needs someone at that level to really help with that implementation piece and to talk about what's realistic for their institution or for the work that they do to be able to move that research into practice, we do try to engage with kind of what's appropriate for the project. So that could be somebody that's at the Ministry of Health, for example, and we could work with their research department there. Or we might look at decision makers in a more clinical setting. If the project is more about developing a decision-making tool, for example, we might engage with a clinical manager or somebody who would be actually in charge of, moving that new piece of evidence or that new tool into practice, so to make sure that that actually works for them. So that's the route that we take in patient-oriented research. And I don't know if anyone here wants to comment on how that might differ in CBR, or Alia or Julia, if you have any ideas about that. But yeah, hopefully that answers your question.
Yeah. And I think it has, from Larry, who's thanking you for that response. And I also wanted to point out that some really fantastic resources have been shared through the chat box that I just encourage you to look into. Some Francisco specifically sharing quite a few research projects, and also some thanks from Swapney, who was sharing how he was personally benefited from this partnership, and so I just wanted to bring that up. Nancy was asking just to kind of clarify if Reach BC is affiliated with SPORE BC, and maybe share a little bit more about what Reach BC is.
Sure. Yeah, Alia, you can go ahead. Actually, I took the last one.
Sure. This is a great opportunity to kind of plug Reach BC. It is a brand new online platform, and the intention for Reach BC was really to connect British Columbians to health research opportunities based on their health interests. So you can sign up, you can create a researcher account, you can create a volunteer account where you're where you would be essentially a patient partner, community partner, or participant. And you can sign up and sort of see what opportunities are available to you and be able to match them. This is a provincial initiative, but it's Reach BC is partnering with a whole number of institutes across the province, including BC Support Unit, to sort of come up with, or to sort of implement this platform. I'm not sure if anyone else has any other thoughts about that, who's been working with it a bit more intimately. But it will be up and running really soon. And for researchers who are working on any COVID-19 related research, it has been it's been open for that purpose. So if you'd like to take a look, please do.
And I guess if you could see that follow-up question, can Reach be used as a recruitment for underserved patients?
Ideally, I think it can. I think that, of course, we'll have to be a bit more cautious and aware of the access to Reach BC in terms of how maybe underserved or underrepresented populations may not be able to access the platform, or may not even be thinking about accessing the platform right now, considering everything else we're going through. And so those are some just considerations that I think we all have to keep in mind.
Wonderful. Thank you so much. And I'm just going to take a couple more questions before we're going to wrap up. We have one great question from Maria here. So wondering about equitable representation. Many projects work on a tight timeline, and researchers may be tempted to recruit patient partners that represent the experiences of already well-represented groups. This can be even more so considering that capacity building on POR, research language, etc. takes time. So yeah. I guess, what can encourage better, more equitable representation with those considerations?
Maria, I think this is such a valid point. It's such a valid challenge that we face all the time. I do not think it's a good enough barrier to not proceed with it anyway, though. I think, like I alluded to earlier, one of the biggest challenges is sort of having people ready to take on POR, and it's one of the things that we work really hard to do. So we do work with our research teams to ensure that capacity building is up to date, to make sure that they feel competent in working with diverse patient partners. We have our patient engagement specialist on the team who will work with the teams to actively recruit various patient partners who represent different experiences. For sure, Larry's point there, it's important to have the engagement skills in place before engaging vulnerable people. To be doing that work yourself as a researcher, to make sure that you're actually ready before you do that work. So my thoughts around that are that it's much more about a willingness to commit to this methodology. And that's where the BC support unit really does come in to help with this, right? So we are the sort of service that wants to provide the capacity building, that wants to provide funding to be able to do this and provide the resources to help you do that. So a lot of those barriers, I think, can be tackled.
Great. And I'm just going to bring up one last question. I know there's probably so many more that'll come, and hopefully we can all stay connected. And thank you so much, Ali and Bernie, for sharing your email addresses as well. From Francisco, and he's asking, what are your plans for provincial or national training for peer researchers, patients with a more or less basic curriculum? So any plans in kind of broadening this knowledge?
So the SPORE Phase 2 is coming up and pretty soon. So SPORE Phase 1 was 5 years long in BC. All the provinces are kind of on a different timeline, but BC is finished March 31st, 2021, and then we launch into SPORE Phase 2 for the next 5 years. That grant application is in progress right now, and based on the last version that I read, there is some thought being put towards training and capacity building for patients. We do have lots of resources already available on the BC Support Unit website that you can access for free, that anyone can watch, and that are really great, all from really basics, basic information all the way up to a bit more detailed, complex stuff. But really great resource to point people towards. And but I think there might be something a little bit more formal coming down the line as we move forward into SPORE Phase 2. So we're really excited to see what that turns into. And definitely, if you have more questions about that, you can email us and we can chat more about it.
Yeah, so I guess before, I don't want to leave this question hanging, are there any resources that teach researchers on engagement strategies and facilitation?
Yeah, so we do offer a workshop on that, just from our center. I'm not sure if there's anything recorded right now on the BC Support Unit website, but Stephanie, if you, as Ali already said in the chat, if you want to send us an email, we can send you some links too, and we can share everything with Julia if the group wants.
Yes, I'm happy to also, along with the webinar recording, have some of these links also posted on our website, so all of you will have access to that shortly. So unfortunately, I'm going to have to start wrapping this up, and it was such a pleasure. I'm going to share just a few more ways that you can get involved with CBR Canada. So you can become a CBRC member as an institution, organization, individual, faculty, or student. Continue to join other CBR Canada webinars such as this. Thank you so much for mentioning our next webinar, which is on May 28th, From Patient-Oriented Research to Patient-Led Research, an exploration from the patient perspective with Beverly Pomeroy, who I could see is in the audience. So hi, Bev. We also have our third webinar of this series on June 18th, Shifting the Narrative, a health-focused approach to research with HIV-positive Aboriginal women across Canada, with speakers Doris Peltier and Tracy Prentice. Also, please join our first live online discussion, which is happening May 14th, on the topic of exploring current challenges of practicing CBR and potential solutions together, especially in this current climate where we're in a COVID-19 climate. So this is an opportunity to engage in a lot of dialogue together with peer researchers and come up with solutions and have a live discussion together. Again, thank you so much for sharing your resources today. If you have other news, events that you'd like to share from your organization, please email us at info@communityresearchcanada.ca. We'd love to share CBR news and events and resources all the time. And sign up for our newsletter, which is going to be on our website. You could see on the bottom. I wanted to just also quickly share a current request for proposals from the Mental Health Commission of Canada, who is currently seeking proposals for community-based research projects in cannabis and mental health with a funding of $50,000 per year for 2 years. And the proposal deadline is May 29th. You can see the link on this screen. And please, after this webinar closes, a quick link will come up. Please take 2 minutes to fill out this quick survey and to give us feedback on this webinar and what future webinars and events that you'd like to see. On behalf of Community-Based Research Canada, I would like to thank all of you for coming to this webinar today, and for Ali and Brittany for today's wonderful session and for informing us on this really, really important work. Please stay tuned and hopefully see you